Good afternoon. Thank you for joining me for this chapter. This is a quick rundown on what Chapter 11 on relationships is about. So we'll have to talk about what is interpersonal relationships, what is a family, and then boundaries in a relationship. And we also have to talk about attachment. Okay. So there's a bunch of words you should be able to explain what it is and define them. Now, it's necessary for us to understand that we are very social beings. Even knowing that some of us might be introverts, we are still in need of social interaction. Might be to a lesser degree, but we all do need social interaction. And then we have different affiliations. That means like family structure or a place where we belong and a place where we can feel safe. And then we have different communication styles. We have passive communication style, and that is where something happens and we just don't respond at all. We keep it bottled up. Sooner or later, this person eventually explodes to an overacting estimation. And then we have aggressive communication styles, where if something negative happens, they'll be aggressive about it, acting in that way. Then we have passive aggressive. And that is if something negative happens, this person holds it inside and to find a way of getting back without being seen. And then there's a assertive communication style. And this is where we clearly state our opinions, feelings, and also allow the other person, respects the other person so much to allow them to also express their feelings, their opinions as um, clearly as possible. So assertiveness, self-assertiveness means that you respect others to assert themselves as well. You shouldn't do it for them, they should do it for themselves. So try to have a clear communication style. You leave rooms to make mistakes and acknowledge them, but you also know how to enjoy and celebrate your successes. This is some guidelines, validating the feelings of the other person, communicating your position clearly, calmly, and confidently. Say no if you mean no. Take your time. Don't say you're sorry or make excuses. And then don't let others or yourself feel inferior. Be specific. Be aware of your tone of voice and your body language. Maintain eye contact. Don't feel guilty if you want to say no. Deal with criticism in a constructive way. And then the next part is the attachment. Attachment comes down to when you were born, there's one person or maybe two people, usually it's the mother, that responds to the infant's needs most often, and that causes attachment to happen. So if anyone else comes to the infant and says how wonderful the infant is and plays with the infant, they will respond fairly nice. But when the primary caregiver does the same thing, the infant explodes with joy and just is so happy this person is there. And this is this idea of attachment. And the main function of this is a sense of security that the infant knows where it is safe. And that's also a reliable source of information about the environment. So if the parent says, no, that's bad, or that is going to hurt you or so, the infant will accept that as truth. And we have different attachment styles. And this is very important to know. We have secure attachment and anxious ambivalent anxious avoidant attachment and disorganized attachment. You should be able to distinguish between what does each one of these mean? How are they different? And when we look at these attachments, it's necessary for us also to see that as an adult, these attachments have grown up. So you will see the secure attachment becomes autonomous. The anxious ambivalent attachment has become preoccupied. and the anxious avoidant has become dismissive, and the disorganized attachment has become fearful, unresolved. And this is what it means. The autonomous one, that's now the secure one, is comfortable with warm, loving, emotional closeness in a relationship. This trust allows the partner to go out and come in, not overly needy, not very clinical. It's a warm environment that they usually appreciate. Then we have the dismissing one. This is usually the unneedy, task, very task functional driven people. So they don't show a lot of emotions. They don't really care if you're there or not. They don't want to. They don't want to be too close. So the independency is the priority because sooner or later you might leave me and then I don't want to pick up the pieces. So I will only rely on myself. Then we have to preoccupy. That's the needy attachment. So this is where the person is not able to move past traumas and they continue just role playing and just thinking and talking about all the hurt in the past. And that causes them to be overly sensitive. And if something happens from their partner, they easily feel rejected. And then we have the fearful unresolved. They try to avoid any emotional closeness in a relationship. They can't tolerate it. So very argumentative, rageous, unable to regulate emotions, abusive, dysfunctional relationships, recreate past traumas. So they usually struggle in relationships and prefer to have all of the control or not be in one. But this is generally speaking. Then it's necessary for us to have boundaries in relationships. Boundaries makes us feel safe, and that's necessary for each one of these attachments type. So when you see where you are, it's easy to say, okay, but what boundaries should I try to aim for? So there's usually four types. I like to lessen it to only three to make it easier for us to understand. So we have a healthy boundary. These people, they usually have a yes and a no. And the no we use to get to know someone. So it's actually a good thing if someone says no. Then we have people that say yes to everything. That's usually the people pleasing. And then we have the no people that have very rigid walls. They say no to everything. Now, just because the yes people say yes to everything, they often disappoint people because they can't be yes everywhere after saying yes to everyone. So people learn to mistrust them. That hurts them a lot. So then they just try harder to keep saying yes, and it just usually hurts them more. So the idea is to have a yes and a no. And that becomes very difficult for people to see the no as actually a way of someone trying to tell them come and get to know me. So if I were to ask you, would you hold my hand? And you would say no, I should use that opportunity to understand that you're saying no for a reason. What could it be? And that way, if you have a assertive communication style, you can tell me because I think it's inappropriate to hold someone's hand who I don't know, as an example. So it's necessary for us just to have the boundaries that's necessary for us to feel safe in. And that's it for chapter 11. Thank you so much for joining me.